Hello, everybody. Hi, it's Dr. Rob Silverman here with Proven Health Alternatives. I am the father of functional medicine, and we're actually live. I cannot believe the technology works. I have Dr. Jeffrey Bland. Dr. Bland, how are you today?
Well, Dr. Silverman, what a treat. I can't believe technology's brought us together in this crazy time that we're now living, but thanks. It's fun.
I'm so happy to have you. And as I was saying before, and I want to reiterate it, so many of my patients, so many of my followers have said, who do you trust? And I told you, number one on my list was my wife. Number two was my mom. But there's nobody that I trust more to talk about health, science, and elucidate a clear message about what's going on than Dr. Jeffrey Bland.
Wow. Well, that's a very, very big compliment. And I tell you, I appreciate it. I'll do everything I can to live up to that. So thank you.
Well, you've been doing a great job. So let me give a little bit of a background on Dr. Bland. Everybody knows who you are, but you have co-founded the Institute of Functional Medicine in 1991. Without question, you're known as the father of functional medicine. I always tease you when I see you, since I'm from New York, we call you the Godfather. Dr. Bland has served as the Director of Nutritional Research at the Linus Pauling Institute of Science and Medicine in the 1980s. Working diligently with two-time Nobel laureate Dr. Linus Pauling, who you've considered your mentor. In addition, you've been the principal author of over 120 peer-reviewed journals. You are also the CEO of the Personalized Lifestyle Medicine Institute. You started that in 2012, and you have a plethora of speaking. I think you've spoken to 25,000 different doctors over.
No, actually, it's now over 250,000.
I missed a zero. I apologize.
That's globally, yeah.
Wow, 60 countries, and you've got 5 different books. And I don't know what to say other than I'm happy that you're here. And I just want to dig right in. I know a lot of people have sent in some questions. So let's talk about it. Immune system's on everybody's mind. So what happens as we age? We've talked about that. There's these comorbidities, and many of these comorbidities are lifestyle modifications. There's obesity, there's hypertension, there's the diabetes. And one of the things that we really theoretically can change, and I know you'll talk about it, is age. So what happens as we age with our immune system?
Yeah, thank you. I think that's a really, really great place to start. And I know there's a lot of apprehension, maybe even fear about this COVID-19, which, is certainly at some level justified. It's a serious problem and it's not to be taken lightly. But I think there are some learnings that we can pull out of this. It might be very positive for us. So I try to find the blue in the dark. I say that we're not in the dark. We're at the dawn here of maybe a new reality about how we achieve better health as a country. And we know that there'll be other pandemics. This is not the last that we'll ever see. So how are we going to deal with them in the future? So with that in mind, I try to remind people that when we talk about these comorbidities that everybody's been hearing about, the people that do the most poorly when they get infected with COVID, as you mentioned, the obesity, which I think stuck out to be kind of a surprise for a lot of people, that was the number one comorbidity was obesity. And then you have hypertension, then you have blood sugar problems like diabetes, and then you got cardiovascular disease, and then you got chronic obstructive pulmonary disease in the lung. And so you started saying, well, these are all very different diseases, one to the other. So, why would they all have some relationship to a viral infection if we assume that the disease is caused by a virus? And the answer is that all of those conditions relate to a derangement or a dysfunction of our immune system. And that's been the discovery that medical scientists have made over the last 20 years, that the underlying feature that connects all those disorders together and that we call comorbidities, they're actually not comorbidities. They're all reflections of dysfunctional or altered immune systems. Whether it's a pulmonary problem, a lung and breathing problem, or it's a vascular problem related to hypertension, or it's an angry fat related to excess body fat. And I'm going to talk a little bit about angry fat versus friendly fat, because angry fat is that's inflamed and causes illness, kind of alteration in our immune defense, and can set the tide towards things like a cytokine storm that we know is a very big problem now with people that are infected with COVID-19. So all these tend to come together around our immune system function. And that for a lot of people may be an aha, because I think what we tend to do in our societies, we tend to differentiate each of these conditions into little silos that we call diseases. So we have a disease here that's this specialist, and a disease here that's this specialist, and we don't see that they're interconnected. This is called upstream medicine, going upstream to try to understand where they come from. And the upstream here is the immune system. So now the question you've asked, now that I've kind of set the groundwork, is, well, what happens to the immune system over the course of aging? And what I would say is it's not age in birthdays, it's age in experiences that the immune system has been exposed to. And I want to stress that, age of experiences. So the immune system can experience really great blissful experiences, up and out, loving, exalting experiences in which the robustness of the immune system is enriched and its ability to defend us is enhanced. Or the immune system can be exposed to a variety of experiences that cause it to be on edge, to be upset, to be angry. That's called the inflamed state, the state of imbalance. And if you think about what characteristics or conditions cause the immune system to be on edge or carry bad memories, they are things that we experience in our lives that would be considered trauma: exposure to toxins, lack of sleep, no exercise, poor quality diets, distress, post-traumatic stress syndrome. All of those things become total loads on the memory of our immune system. Our immune system has incredible memory. And it remembers all those bad experiences, and it tends to then weigh itself towards, oh wait, tomorrow's going to be another bad day, I better just be on guard. Not like tomorrow's going to be a great day and I'll be at rest and relaxed and I can accommodate anything. No, now I've collected memories that so condition me to be on edge that anything that happens, I'm going to react really quickly, and I'm going to be inflamed, I'm going to be aggravated. I'm going to mobilize the god of war, Mars, the color red, inflammation, rubor, color, and dolor. I'm going to get inflamed. And that condition sets the tone for a different way we respond to a virus. When a virus then comes to us, which eventually it will, it could be the common cold, or it could be the flu, or in this case, a mutant form of a coronavirus. It's very much more infective. When it comes, our body is going to have a state of readiness. And it's either going to be relaxed and saying, bring it on, I can handle it, or it's going to be, oh, here it comes again. I'm going to react, and I'm going to react strongly, and I'm going to react in a way that is not well orchestrated, and I'm going to call it out of the guards, and now I'll do everything I can because I don't have the proper balance points. I lost my control mechanisms. And so what we're really witnessing right now, when you start looking, and you probably know, I'm holding a paper right here. This just appeared in the Journal of American Medical Association. The title of this paper is Variation in COVID-19 Hospitalizations and Deaths Across the 5 New York City Boroughs. Now, this is a very powerful article because it really tells us something about what you were just saying as comorbidities. So what these investigators did is they assembled information around the different demographics of each of the 5 boroughs in the New York area. And so they looked at mean average income, mean average education, age, employment, utilization of the healthcare services, number of hospital beds per thousand. All these variables were assessed in each of the different 5 boroughs. Then they looked at the infection rate with COVID-19 and the hospitalization rate and the death rate per 1,100 people in each of those boroughs. And what do you think they found? Well, I'm not going to be probably surprising to tell you the conclusion, because you probably would already guessed it, that Bronx, which has the borough that has the greatest social deprivation, the greatest problems of what we might call comorbidity, or these dysfunctions of the immune system, had twice the hospitalization, twice the infection, and twice the death rate per 1,000 of any of the other boroughs. So you start saying, well, what is COVID-19? Is it just a virus by itself, or is it really a lifestyle disease? Is it really a virus that interfaces then with a person in a unique way based upon what the status of their immune system is? And let me finish this. I know it's a long diatribe and a run-on, but I'll finish by saying the assumption in our medical system throughout the last period of time, decades, is that health means the absence of disease. So if you went to New York in the 5 boroughs, and you might say, well, what are the disease differences in these different people living in these different boroughs? You might come up with a different answer than if you ask, what is their functional immune system like in the 5 boroughs? Because people with a dysfunctional immune system may not yet be diseased, but they're also not healthy. And so then it bears on the question, is the answer to these problems just immunization and finding a new drug? Or is it a combination maybe of that with an underlying upstream question about how do we actually improve people's immune resilience? Because the immune system will remember, but it will also relearn new messages. That's the exciting part of it. Yes, it remembers bad experiences, but as I tell people, every 10 seconds, we produce 1 million new white blood cells, 20 million new red blood cells, and 30 million new platelets in our blood system every 10 seconds. So we're rejuvenating ourselves all the time.
Could you say that again? I'm sorry for interrupting you. Could you
Yeah.
say that again?
Yeah, every 10 seconds on average, this is like just an average day. You're not sick. You're just kind of walking around the world. You produce 1 million white blood cells, the cells in your immune system, every 10 seconds, 20 million red blood cells, and 30 million platelet cells, all a part of your defensive system and the ability to deliver oxygen to tissues and to power up metabolism and to defend yourself against infection. And so you're constantly rejuvenating. But what happens if you don't have the rejuvenating power? What happens if you've already scraped the bottom of the barrel, you've taken out of your bank account of immune resilience, and now the next cells that you produce, they've just they're worn out. They don't have the ability to rejuvenate. They just are replicating the cells of their past, which are already aggravated and damaged. So when people talk about immune support, I say, well, are you sure you want immune support? Because if you're supporting a damaged immune system, you're not going to get optimal function. What you want to do is rejuvenate your immune system by giving it the full power that it actually has inherently in its ability to recreate itself and to kind of undo some of the mistakes that you were from past experiences.
So I'm going to synthesize this because that was great. That was a lot of great information. Number one, we've used very commonly the idea of immune support, and it may not be correct. We really want to consider immune rejuvenation, because we may not want to support our immune system because it may not be functioning well. So we want to rejuvenate it, and you gave some great stats to speak to that. In addition, a lot of people so much who are following you agree with you that it is a lifestyle disease. Those, at least the comorbidities, are a lifestyle disease. Fantastic. And I think you really need to go into detail and tell people about the immune system and the memory, about where the difference is between the innate and the adaptive immune system, because, you know, we don't have any memory to this virus because we haven't seen it before. It's novel. So I'd like you to expand on that if you could.
Yeah, I think you've said a really important step into this topic right there that I think is worthy of a little bit more explanation. So I'm going to talk about the immune system in very gross, broad terms now. So those of the people listening that are immunologists might think that I'm kind of being too broad, but to get into the topic, there are two kinds of immunity that our body possesses. A first line immunity, which you already called the innate immune system. It's the most primitive, ancient immune system. It does hand-to-hand combat with foreigners. It fights them in a trench warfare, and it generally can kill them if it's working right. If, however, that system cannot do the job and something slips through, then you have the second level system. I'm making this more simplistic than it really is, but to make a point, that is called the adaptive immune system. And this is a series of T and B cells that are produced out of our bone marrow. That's where all of our immune system comes initially, is from our bone marrow. And those cells then are differentiated in such a way is they will kind of remember what you've been exposed to. They produce what are called antibodies, and these antibodies have a memory effect. And so that's what actually leads to immunization or immunity, when you have a memory of having been exposed, and your body's immune system, your second line of defense, your adaptive immune system, responds by producing specific antibodies that glue together foreigners and cause them to be taken to a place where they can be executed and eliminated. So the T cells and the B cells, as part of your adaptive immunity, work with your first line defense, which are your monocytes, macrophages, and neutrophils, which are the ancient immune system, to form a full package. Now, what happens if you are, as an individual, in a state of immune imbalance? what can happen, and this is part of the whole story, is that your first line of defense, your innate immune system, has been so injured and so poised for a lengthy time that it's constantly on guard, and it's producing inflammatory mediators. It's producing agents to do warfare even when you're not really at war. And this is called chronic inflammation. Sometimes it's called sterile inflammation, meaning it didn't even wasn't caused by an infection. It's just your first line of defense, on guard and hyper vigilant. And so what happens in that case is that person has got resonant low-level inflammation going on all the time. And this is very common in the people that have all these comorbidities that we talked about. They're carrying these low-level inflammation. Now, what happens then on the back end, the second line of defense in those people, is they've been depending on this significantly to do the work for them through this memory effect, that eventually that system, that thymus-dependent lymphocyte and those blast cells, those basophils, they lose their energy. They run out of gas. And this is called immunological aging or immunosenescence. And so now you have a front end that's all hyper functioning and the back end that's tired and worn out. Now, this is not a good way for your immune system to be balanced, right? Because you are in a state of constant arousal, but you don't have the back end to really quench things and to manage things and put it back at rest. And so you then have the difficulties of the person might on the front end, if they're inflamed, what might they be taking? Something that reduces inflammation. That's like an immunosuppressive drug. So how many people in our country are taking immunosuppressive drugs? It's millions. It's actually tens of millions. So you suppress that front edge because you have too much inflammation. You expose to the back end that's worn out. And now what do you get? You get infection, and it starts to really take over. So your immune system in that case does everything it can to protect you. So what it'll do when it sees that it's got this imbalance and things are running amok is it calls out every guard it can call out. It says every fire station, every truck go out, and we need to do, and what do we call that? A cytokine storm. It's an immune system out of control. Now, the actual disorder the person has is their own immune system overworking against them. It's collateral injury, bystander injury. And what happens is all those things that immune system can produce when it's hyper-functioning, like mucus and phlegm, fluids, it chokes on the lungs and it causes all sorts of problems with the heart. And now you have the immune system itself actually leading to death. So that's the extreme edge of this whole sequelae that I've talked about. So it's really when we talk about rebalancing the immune system, it's resetting both that first line of defense, the innate immune system, and the second line of defense, the adaptive, and re-energizing. That's why I call it rejuvenation, because it's kind of worn out. It's tired. It's run down. We need to pump it back up.
So some great terms you use there: immunosenescence. It's the aging of the immune system and cells, which I know that you'll address in greater detail. The rejuvenation is outstanding. And I heard you once say the difference in the two forms of immune system, innate and adaptive and acquired, was very simply that the innate was your search and destroy, and that your adaptive and acquired were recognize and remember.
Yes,
So
very well said.
That was you. I took that from you. You get the credit for that. But
thank you.
That memory we don't have. But you're speaking about the balance, and I think a lot of people really want to know, it's supposed to be balanced, your innate and your adaptive. And when it's sort of imbalanced like this, your innate's too high and the acquired is decreased or adaptive is decreased, you're getting that cytokine storm because you're overworking. Mm-hmm. Now, interestingly enough, you spoke about this being a modifiable lifestyle. And we all know that sugar, starch, poor fats actually make this system aberrant. And I know you use the term angry fat. So
yeah, I think thank you. This is another thing that I believe most people do not understand. And this comes from recent discoveries, I would say recent meaning within the last couple decades. So let's say the last 10 to 20 years. It's now recognized that fat cells, they're called adipocytes, that sit around, not only around our middle, but in other tissues of our body, that those fat cells have a personality because they were derived from the same progenitor cells or the same precursor cells that our immune system was derived from. So they have a familiar relationship to our immune system, these fat cells. And within the fat cells, within the family of the mass of our adipocytes, because they have close relatives with our immune system comes and visits them. So the macrophages, parts of our innate immune system, come in there and hang out within our fat cells. And if they find that the fat cells are fed up, that's my analogy, fed up, meaning they're not going to take it anymore, right? The fat cell says, I've been working for so long to try to store all this extra energy in the form of fat, and I'm just tired of doing it, and I'm fed up, and I'm going to talk back. And I'm going to talk back by speaking to the immune system, my buddies, telling them they've got to send a message out to the rest of the body that I'm really kind of pissed off about the situation I'm in. That is what I call angry fat. And now the whole body gets the message of being upset, the immune system upset. And that is, in a simple language, why there is a relationship between obesity and COVID-19 seriousness of the infection, because it puts the immune system on edge. That's why obesity has that link.
Fantastic. So as they all say, fat cells are depositories for toxins. We've used specific inflammatory terms. So obesity is that centerpiece for a lot of those comorbidities. So I'm going to take it to the next step because we have a lot of people that are into functional medicine and everything. And I'm going to go right for it. I'm going to go to that gut and the gut's impact. You've spoken about the liver organ. It's an immune organ. It's got the largest amount of macrophages. So we all know gut to liver, gut to lung. And now we're talking gut to brain, and there's gut also to hypertension. So let's talk about the gut's impact on the immune system and its impact on these other organs.
Yeah. Well, you're doing a beautiful job here of going through the functional medicine lexicon and showing what I call systems biology, the interconnectedness of our web of life. So let's trace through this immune system one step further, because you've already taken us and opened that door. So you indicated accurately that the liver, which is a metabolic organ, is also an immune organ. 10% approximately of the cells that make up the liver are actually embedded white blood cells. They're called Kupffer cells, and they are part of our immune system. They just happen to reside in the liver. So now I've said, well, gee whiz, we have immune cells that are in the fat, and we have immune cells in the liver, and we have immune cells floating around in the blood. Well, we also have immune cells in the brain, and they're called the microglia. So they're also part of this communication system. So you might say, well, how does dementia relate to chronic inflammation? How does all these immune disturbances translate into presenile dementia? That's connected as well. Now, lastly, as you've indicated, the other place where we'll find 70% of the immune system, 70% is in the gut-associated lymphoid tissue around the intestinal tract. Now, people have asked a question, and it's kind of an interesting theoretic question. Why would the immune system be so heavily represented in the gut? I mean, was there no better place to put it? It just kind of was attractive to stick it in the gut? Well, no. If you think about it, over the course of living, an average person will eat about 10 to 15 tons of foreigners. We don't eat ourselves. We eat molecules from food that are different than we are. And therefore, our body has the responsibility before that food gets into our body to figure out what's friend and what's foe. What system does that for us? It's the immune system. And so the immune system is clustered around our intestinal tract to be our translator of how food and things that go into our gut, food and beverages, get translated into our body. And so it's the first line of immunological recognition is that that gut. And then lastly, you would say, well, are there any other places where the immune system touches the outside world directly? And you already indicated what it is. It's our lungs. Our lungs have an immune system. And our lung immune system connects to our gut immune system so that we now know that chronic obstructive pulmonary disease is exacerbated by dysbiosis, meaning when you have an imbalance of your gut microbes that then alters your gut immune system, that your lungs come along for the ride, because your gut and gut and lungs both have microbiomes that are interconnected one to the other through our immune system. So this network understanding allows us to then understand how all those variables that are associated with COVID can be connected to the immune system. The lungs, the liver, the heart, the fat, the blood vessels, they all connect through, and the dysbiosis of the gut, all connect then to the immune system.
Absolutely great. There was a 2018 article that spoke exactly what you're talking about the translocation of bacteria changing the lungs bacteria into a dysbiotic state. And that was fascinating. Increased the incidence of sepsis and acute respiratory disease syndrome. In addition to that, and we learned that in our functional medicine matrix, the body's all interconnected. So it's communicating through systems, it's not symptoms. And our goal is always root cause resolution. But there's another system that I'd like to talk about. You know, I'm a chiropractor, so we're big on the nervous system. Yeah. And I've heard you give some great explanations on different factors of the nervous system, but I'd like you to explain the actual direct tie between the nervous system, the central nervous system, and the gut.
Yes, I think that's a really fascinating emerging area of understanding. So let's look at one of the cranial nerves, one that I think is getting a lot of attention, the vagus nerve. So where do we know that the vagus nerve goes? I mean, it goes many places, but one of the central places it goes is the second brain, which is called the gut. So the vagus nerve is interwoven very tightly with the gut immune system, which is very tightly tied to the gut microbiome, which is very tightly tied to the architecture and function of the nervous system as a whole. So if a person has a nervous system that's alarmed, just like the immune system, it could be by an injury, or it could be by a misalignment, or it could be by a bioenergetic dysfunction. That nervous system then communicates to the immune system, which communicates to all those organs. So now you have a system of unrest. It's not, you just can't say it's caused by one thing. It's a system that is now perturbed. And the nervous system, like the immune system, are the places where our inside body touches the outside world. People don't recognize it, that when we breathe things, that those nerves that are in our nose that transmit odors to our brain are really the place where the brain is directly touching the outside world. So if you breathe a bunch of toxic chemicals, those go right up those nerves into your brain and have an effect on your brain function. So these are really important parts of really designing an approach towards what I would call complete health, not just treating each symptom as it's in individual organ, but treating, as you said, upstream, root cause, origin of the problem.
Outstanding. And we all know 1/3 of the people with COVID have lost their sense of smell and a taste, which really implicates the cranial nerves going to the central nervous system. And music to my ears about the vagus nerve, you know, medulla oblongata down through the transverse colon, affecting all the organs, especially the lung.
Yes.
And most interesting in that it attaches to the outside of the transverse colon. So it senses, that's why it's afferent, talking to the bacteria. However, with that, you said the enteric nervous system, that as a chiropractor, there are no more nerve cells than anything in the enteric nervous system. So it's just, it's a cornucopia of information for me. I love it. And it's interesting how that is communicating, how the body's all interconnected, but yet it does start in the gut. And there's a couple other things that we may want to touch on. You know, now there's a study that came out about wastewater, and the wastewater could tell you, because you shed the virus before the symptoms and 28 days after the abatement of fever in COVID-19, that the gut is shedding the virus, even if you're asymptomatic. So you know, if you could speak to the idea of why does the gut shed it? How does it do it real quick? I know you hadn't gone over that in some other podcasts, and I felt that you really wanted to speak.
I think it's very important for people to understand that one of the places that the coronavirus lives is in the immune cells themselves. The classic and quintessential example of this that people are probably familiar with would be HIV. If you think what HIV did, is it lived specifically in cells like the T helper cells in our immune system that killed them, right? And as a consequence of the severe infection with HIV, people lost their immune system and all these opportunistic infections happened. So if you think early on in the 80s, before we had the multiple therapies to treat HIV, the people were actually treating symptoms. And in hospitals where HIV AIDS was very prevalent, they were calling out every kind of antibiotic, antifungal, I mean, all these kind of drugs to treat infections, because when the immune system was so compromised, we're carrying bugs in our body all the time that our immune system doesn't even let us know about. But as soon as our immune system goes to sleep, now those things become evident, they can gain a foothold. So when we start really thinking about the nature of where these viruses live, in part, even COVID-19 lives within the immune system, and it can kill those immune cells. And remember, we've already said that 70% of our immune system is clustered around the gut. So it's not surprising that one of the symptom clusters you're seeing with COVID-19 patients are intestinal related things, diarrheal disorders, gastroenteritis, because you are disturbing where the immune system resides, which is in the gut.
So I'm looking at my phone because we're on Facebook Live. I have a good friend of mine. He's in Geneva, Dr. Robbins. And he said, the key question is, what do people do now if they have less functioning immune systems with the pandemic spreads? How do they balance making quick improvements to help them be safer today versus how much they need to isolate more to avoid contagion today? Long term, some people will hopefully make changes, but how do people make changes now to feel safe? And
Well, I think that's a really, that's quite a remarkably good question, but it's also a pretty expansive question, isn't it? Because we still have people debating in our country whether it's safe for everybody to come outside and just go back to life as usual, which I think is totally facetious and for which there is no knowledge or information of any rational type that would really support that. I think that is, anybody that's carrying that in their minds is not looking at the facts. And so let's talk about, first thing is to keep social distancing, keep away from big crowds, and do the things that we know to protect ourselves against exposure to droplets of virus-containing material from other people. So it's not too, we're not over that yet. So that's one. But number two is, we can start doing things, each one of us, to start rejuvenating our immune systems and give our greater resilience and greater, what I call it, reserve. It's like putting something in the bank account. The analogy I use is, if you're constantly withdrawing from your bank account, you might not be overdrawn, and you might say, well, it's fine. But as soon as an emergency comes and you've got to repair the roof or something, and you go to your bank account, the next thing you know, you're overdrawn. And now you got a problem. Someone's at your doorstep wanting to take a piece of your flesh. So the same thing holds true with the immune system. You can be moving right along every day saying, well, I'm not getting the cold and flu, I'm fine, but you're pulling out of the bank account. So when you really have a need to pull up this reserve and to mobilize it, you just don't have it in your bank account. So how do you rebuild your reserves to give you greater resilience? You do so by recognizing, again, that coming out of your bone marrow, as I already indicated, every 10 seconds are all these immune cells that are waiting to be imprinted with information of goodness or aggravation. So we need to turn the clock back to regeneration, away from feeling you're at war. And what does that mean? Eat diets that are not offensive, because we know bad diets create inflamed response. That's a simple model. And so we can maybe get away with some of that bad diet stuff when we have a lot of immune reserve. We can tolerate it occasionally. But if our immune reserve is compromised, or we want to rebuild our immune reserve, we want to really be very committed to eating friendly foods and staying away from hostility. So we should have a very clear do and don't list as we're rebuilding our immune system. And we pretty much, all of us know what that list is. Sometimes we just kind of forget it. But the do's are eat close to, Michael Pollan has said it, eat plants, eat variety, and eat in moderation, and try to control things so that they look like they once were alive. and not they come with a list of ingredients that you can't understand unless you get a chemical textbook to understand them. And try to stay away from sugars, particularly added sugars. Give up sweetened beverages. That's a good start. Make sure that you get proper balanced protein and that you get proper omega-3 fats so that you get those friendly fats. I mean, there are certain things that we know are universal good ideas to feed your immune system. And then stay away from hostile foods, foods that are fried, foods that have too much sugar that's been combined with protein to produce these glycotoxins. Stay away from foods that are very rich in palmitic acid, which is feedlot-fed beef, basically. Stay away from foods that are constructed in laboratories that would be shelf-stable for decades. Those are the things that we, I think, recognize as good starts. Then on top of that, we start adding the question, or we can add the additional question, are there specific nutrients that have been identified to give us a booster rocket in the recreation of our immune system? And that's really exciting new stuff. And I think, to make a long story as simple as possible, where those discoveries are taking us is not to leave behind vitamins and minerals. Those are important, certainly, but it focuses on this family of thousands of chemicals that we call phytochemicals in plants that we now recognize have unique effects upon immune signaling, unique effects on immune rejuvenation that become part of the immunorejuvenation program. And these are things that, unfortunately, as high processing of our diet has occurred, we've taken out of our food because they generally tend to be flavor enhanced or flavor contributing products that people don't like because they might be bitter or produce a different taste. And so people now like things that are sweet and fat, and they don't like things that have a lot of other flavors. And so as a consequence, our diets have started really becoming very, very low in these immune rejuvenating phytochemicals. You've heard a lot about quercetin. That's one of them that's in the news a lot. But luteolin, diosmin, fisetin, hesperidin, epigallocatechin gallate, resveratrol. I mean, the list goes on. We can make a whole lexicon. But these come from plant foods and fruits and berries, nuts, seeds, whole grains, vegetables. You find these families of products. So enhancing those in our diet is going to help build back immune reserve.
Yes, that was great. The plant-based diets, the flavonoids, the quercetins, like you were talking about, those phytochemicals. I learned that the reason they're so enriched with these phytonutrients, they actually taste kind of bitter because they protect themselves against getting attacked. And the more bitter a vegetable is, or any kind of object like that you eat, it has more phytonutrients. Really great takeaways, because, we don't talk about food. And somebody famous once said, food is a potentiator for inflammation. Food may be a potentiator for information.
Yeah,
I
well said.
From somebody.
Yeah.
You.
Food is information. I really agree. It speaks to our genes, and it can speak a language of friendliness, or it can speak a language of hostility, depending on what it is.
Getting back to that angry fat. So now that we talked about genes, I think that's a great segue into the next question about epigenetic modifications of the immune system. So a lot of people want to know, like, well, why is my immune system different? Or what does this environment, what I do, how does it change my immune system? Mommy and daddy gave it to me and that's it.
Yeah, I think, again, you're really asking such incredibly important questions. Each one of these questions obviously could be expanded into a huge discussion because they're very important and they have a lot of substance to them. So I'll try to give a broad brush response to that really important question. So as you know, our genes control a lot of our function, obviously. But one of the things that we've learned about our genes, which has been quite surprising, is that the human has about 25,000 approximately genes that control the production of its proteins, of our proteins in our body. And so you would say, well, that seems, like quite a few. But if I was to look at rice and ask how many genes are in the rice plant, it's about 50,000, twice the number of genes. Now, most people would say that a rice is not as sophisticated as a human. I would think you would think that. So why would you have so many more genes in a rice than in a human? And what we have learned in the last 20 years since the Rose Garden deciphering of the human genome story was presented is that the human genome, only about 5% of the DNA in that genome, or the nuclear material, codes for proteins. In other words, has genes. 95% doesn't have genes. So you're going to say, what is it? Well, it used to be called junk DNA, but it's not junk. It actually is where the information resides that tells the genes how they're to be expressed in different tissues at different times in different ways as assemblies of genes. So it's not just that we're one gene at a time, one for hair color, one for eye color, one for skin color, one for height, one for this. We're multiple genes all orchestrated together that are controlled by this, what we used to call junk DNA, which is really the dark matter of our genome, that is regulating how our genes are expressed as families. And it's in the expression of the control of our genes as families that makes us unique as an animal in our planet. It's the sophistication of the regulation. Now, why is that important? That's important because those control mechanisms that regulate how our genes are going to be expressed to create how we look, act, and feel are in direct communication with our environment and our lifestyle. And they're influenced through the process that you already told use the word epigenetics. The stuff above the genes are the controlling factors that actually regulate how these genes are going to be expressed. And the genes can actually be marked by our experience, by how we eat, how we think, where we live, what we're exposed to, what drugs we've taken. Our lifestyle environment actually puts marks on those genes that regulates how they're going to be expressed. Now, one of those marks that has turned out to be very important, that you've spoken a lot about over the years, is the methyl groups, methylating the genes. And the methylation process is one of the regulatory processes that controls epigenetics. It actually puts these methyl groups on the promoter regions of genes that cause them to not be expressed, not to function. So it silences those genes. So methylation of genes that are related to your immune function might not, if they're overly methylated, might not be so good because now you become maladapted. So studies have shown that people that go through post-traumatic stress have changes in their methylation patterns of their genes. People who have nutritional imbalances have methylation differences in their genes. We now recognize that we can regulate these epigenetic mechanisms. Now, let me close by saying an amazing study was just published last year out of Stanford and UCLA schools of medicine. Steve Horvath and Glenn Fahey being the principal investigators. What they did is they took average individuals, presumably healthy, and they measured the methylation patterns on their white blood cells, part of their immune system. And they were able to correlate their age and birthdays with the amount of methylation that occurred to their genes. And they were able then to correlate that with what we call aging. However, what they also found is that although there was a direct correlation between methylation patterns of our genes and our age, that there were those people that had certain methylation patterns that were associated with young people, but their age and birthdays were large. And they had other people whose methylation patterns were associated with old people, but their age and birthdays was young. You follow what I'm saying? So they were not directly related. They were correlated, but not the same. They then, and this is the aha, they then did an intervention. The intervention was to have those individuals take 3 different products. One was Metformin, a drug to manage blood sugar. The second was DHEA, a substance to manage cortisol and stress. And the third was human growth hormone to manage cell replication and things like you can increase human growth hormone by exercise. So they gave them those 3 drugs. And what did they find over the next months? They found that they reprogrammed the methylation programs on their immune system to move their age, their biological age, back 6 months in a year. So when people say that our age is immutable, it is true that our age and birthdays do come whether we want to cheat or not. But what is not true is that our biological age or our functional age or our immune age is identical to our chronological age. And that's modifiable. And that is what is giving people more resilience to things that are unexpected, like viral infections.
So what you're saying in the close, as I synthesize once again, is there is a chronological and there's a biological, and that through lifestyle changes, we can definitely affect our biological, and everybody should start now. And that's the huge takeaway. Genes are not our destiny. We've seen you say that. You know, they load the gun, you got to fire the gun. Interesting. So that's great. So everybody's sitting there going, the immunorejuvenation means you have that opportunity, as you gave those numbers, every day to make an impact. So it's never too late. It's like the Bible says, you're always going to get a second chance, and you get that second chance today in your rejuvenation. And what was fascinating about the methylation is that there was an article, and we talked about it a little bit before, that if you hypomethylate, you can't make one methyl group, you have an increase in the cytokine storm. So genes, again, are something that's worthwhile. And in the parlance of the functional medicine matrix, methylation and genes are a critical element to look at patients right now as we do telehealth.
That's right. Exactly. And it's very interesting that there are new technologies being developed, new laboratories that are just coming online that'll provide reasonably easy way for a person to understand the methylation age of their immune system. And when that happens, this will be one of the post-COVID-19 things that change healthcare. When we start to be able to measure the function of our immune system and track its performance based upon things like methylation patterns, we will actually have a way of dialing in how that person is doing relative to their immune reserve. It won't be a shot in the dark. It'll be something you can actually compete against your own methylation biological age, which is pretty exciting.
This has been great so far. So there's an article that you wrote in medium.com. It was April 1st. It's called Reflections on COVID-19 Pandemic. You did a great job. We spoke a little bit about it. You correlated the HIV issue, the viruses, that it's not our first time that we've had a virus pandemic, and unfortunately may not be the last. You also gave a good delineation on specific nutrients, zinc, vitamin C, vitamin D, and the like, and that's all in there. But you said something that was really interesting in that you don't necessarily think that the statement is correct that a virus is caused by a single agent.
Yeah, I think that who am I to ever question Anthony Fauci? I mean, he is, as we all recognize, certainly one of the quintessential viral researchers in the world, going all the way back to HIV/AIDS in the 80s. So I have great admiration and respect for him. And he did write this article that appeared in the New England Journal of Medicine about the nature of viral pandemics or viral epidemics. And he made the point that these were very different than other kind of diseases because they're caused just by a single agent, a virus. And I don't disagree that we can identify the pathogen or the vector that causes a specific infection. But my point of disagreement was the vector doesn't work in a vacuum. The vector or the virus gets into an incubator called our body, which may be more or less susceptible to its replication. And it's that other variable, maybe you can't actually prevent the exposure to the virus, but you certainly can do something to modify the environment in which the virus might be seen, your immune system, by the way you treat yourself. So I just wanted to make sure that we didn't kind of throw the baby out with the bathwater and say, oh, it's all about the virus, it's all about immunization, it's all about a drug to treat the virus, when there's this other part, as I showed you with the boroughs of New York City, that are related to how we live and the situation we find ourselves in, the variables that lead to our health and reserve. Those are as equally important.
Agreed. You can't control the virus, but you can control the host. You got to invite it in. You have to invite it in, and our best defense is our immune system. So I think we have another question, if you're okay. All right, I'll give him this one. Do you control homocysteine for methylation?
Well, that's a good question. I think homocysteine has for a long time been considered kind of a marker for 5-methyl-tetrahydrofolate's connection to acetylacetylmethionine, which is then known as the methylating agent, as a SAMe. And there is a connection between high levels of homocysteine in the blood and insufficient B vitamins to support SAMe's formation and methylation. However, that relationship is more complex than we originally thought. We used to think, oh, you just look at homocysteine and that'll tell you exactly how much folate you need or how much B12 or how much B6. And it's only like a shadow dancing relationship. There are many other variables that you need to include other than just homocysteine itself. But I don't want to throw homocysteine out as not important. It is, but it's only part of the whole story.
Right. And we can get those on blood labs, and you can check your genetics, and that's a great standard. You know, a little personal, a patient of mine actually has high homocysteine, and they immediately wanted to put him on drugs. I'm like, wait a minute, wait till the genetic tests come in. Let's take a look and let's get full disclosure. I definitely want to get to this question before we open it up on Facebook. How is healthcare going to look differently through the lens of what's coming in the future post-COVID-19?
Yeah, I think I'm just finished up an article that'll be coming out in Medium this week, which I said the 5 things I believe will change in healthcare post COVID-19. So what were they? First of all, I think that our definition of public health is going to change irreversibly, going from community-based health to precision public health, meaning getting down closer to the individual and not just gross community-based assumptions. Because only when we can start introducing precision public health can we really understand how to take information we gain around populations and convert it to individuals to create outcome that's improved. A public health in a community-based model only is able to ask questions. It can't answer those questions. Precision public health, however, which is emerging out of a variety of work, contributors like Christopher Murray with his Institute of Health Metrics and Evaluation in Seattle that got a $250 million Gates Foundation grant. They're really taking this to the next level. So that's number one. Number two is I think that prevention will be redefined in this. Prevention won't just be risk factor reduction to the major diseases. Prevention will be actually looking at how we improve immunological function so that it will cut across. We're treating the cause and not just the effect. Because just treating risk factors like high cholesterol or blood pressure or putting a person on an anti-inflammatory drug is not really treating the cause, it's treating the effect. And so I think prevention will actually move upstream and start to really look at these factors that relate to immune function, body, mind, spirit, nutrition, all these various variables that relate to immune function. Third, I think that we're going to witness, as we're already seeing, a change in the way healthcare is delivered. Telemedicine and virtual practices and group practices will become more real because I think they've already demonstrated efficiency. Yes, we need the press the flesh type of practice. I don't want to say everything is going to go virtual, but I think we're going to find more efficient ways of getting information to people in need. And it'll give us tools to go to the underserved, the medically underserved that we haven't previously been able to use, principally because we didn't have a reimbursement system to pay for services in that capacity. And I think now we're starting to see new ways of actually reimbursing practitioners for their time spent in these kind of virtual practices and group practices. Next, I think we're going to witness a very interesting change in how we see the globalization of disease. I think in the past, we've been thinking very myopically about a disease is just around me or just around my local environment. And we clearly see from these pandemics that we're interconnected through our air, water, land, soil, oceans, that you can't just disconnect yourself from the nature of the biosphere. And planetary health is going to go from kind of an artifact to become very important because the health of an individual's immune system is dependent upon the health of the immune system of plants. And yes, plants have immune systems, which is dependent on the immune system of our planet, which is called the Gaia hypothesis that we're pulling back from spaceship Earth at the beginning of Earth Day 50 years ago. And all of those are going to be transformative in the way we think about health, how we reimburse health, how we train practitioners, and how we deliver both through primary care and through para-health professionals and health coaches, what will be the new medicine of the 21st century.
Outstanding. So I was looking down, and the reason I'm looking down is I have the phone, a lot of shout outs. Love what you're saying. I didn't realize you've been doing this almost 40 years. I thought it was 35. I don't know if you wanted me to share that. Somebody asked, it's a great question. We really didn't touch on it. Autophagy's effect on immunorejuvenation.
Oh, thank you. I was kind of avoiding using that term because for a lot of people, that's kind of like one of those terms like, whoa, what the heck does that mean? But autophagy is actually one of the processes that specifically is related to immunorejuvenation. It is autophagy means self-eating, auto-eating. You're eating up damaged materials. Your body has a process to eat up, digest, and spit out damaged materials like damaged immune cells. And it does so in a regulated process that actually won the Nobel Prize in Medicine and Physiology just a few years ago for its discovery. And it is a very important part of the recycling system, so that we're not just carrying a bunch of debris in our body that, kind of jams up the work, so to speak. And the immune system can collect debris. It can undergo what are called clonal hematopoiesis of indeterminate potential, CHIPS. So CHIPS are things that can actually kind of get into our immune system and gum up the works. And so the process of turning back immunosenescence or rejuvenating the immune system is dependent in part on supporting these selective autophagy processes, which, by the way, these specific members of the flavonoid family that I was describing in our diet have been shown to be autophagy stimulating nutrients. So it is all a new theory and a new concept that's emerging beyond just immune support into this concept of immune renewal, rebooting the immune system.
Fantastic. Autophagy did a great job breaking down the old cells, using that energy to make new cells. So again, speaking to the idea of immunorejuvenation, autophagy comes through fasting and some of the foods that you recommended. Also, what a great takeaway. Another one of the questions was, men seem to be implicated more, higher fatality rate. Is it the comorbidities, or is there an epigenetic factor to it?
Yeah. This is a very big area. I'm sure you've talked about this previously, that's being debated among scientists. We know that in women who have higher estrogen, obviously, that estradiol is an immunoprotective hormone. So individuals have said, well, this is a hormonal difference between the steroid hormones in men, androgens being predominant, versus in women, estrogens being predominant. And so this is a biological difference. Well, I think there is evidence to support that, but I don't believe that's the major driving factor. I think the major driving factor, when you look at, again, public health statistics, is that men on average smoke more, they consume a lot more alcohol, their lifestyle habits are generally not as good as women. And when you start looking at the variables of certain lifestyle related diseases, they're more prevalent in men than women. Now, in autoimmune disease, we have more women than men. About 80% of autoimmune disease is in the female. That's a whole different story. We could spend quite a bit of time about that, but let's just focus on the comorbidities that relate to the increasing risk to COVID-19. Those, I think, are more male lifestyle related conditions than biology.
Absolutely. The last question was, I know it's funny because we've talked about it. They said, did you play basketball in college?
Yeah, I did actually. I had a really great time. Started off with being mentored in my first years of college by arguably one of the great coaches, John Wooden. And then I spent my last 2 years playing at a new University of California campus, University of California, Irvine, where I graduated. I think I was in the first graduating class from Irvine in 1966. So yeah, I played 4 years in college.
So basically, you were mentored by John Wooden and Linus Pauling.
Yeah, I consider that pretty good start. I really was very lucky.
Not a bad day. So, okay, I'll ask. They wanted to ask. This is an easy one, low hanging fruit, but it's important. a lot of arguments about some of the nutrients. So they wanted to ask about vitamin D.
Yeah, that's a good one.
Chance of cytokine storm.
Yeah, so vitamin D, like vitamin A, those two immune related nutrients have what's called a curvilinear relationship to immune function. Now, what does that mean in English? It means that not enough is not good, but too much is not good. So there's a kind of a zone of optimal intake. So you don't want excess and you don't want insufficiency. You want to be in the zone of self-regulation. And for vitamin D, there's a lot of kind of debate about what that level is, but for me, it's somewhere around a couple thousand IUs a day in that range for being in the zone of good support. Now, there may be reasons to have more in certain conditions, or even in other conditions, maybe less based upon how much 125 dihydroxyvitamin D your body makes. But I think that 2,000 unit is a pretty safe in the middle number. For vitamin A, that's another one that has a curvilinear response to the immune system. Too little is increased infectious disease. Too much is increased immunological problems. So what's a good amount? Probably somewhere around 2,000, 2,500 units. And I'm talking now specifically about vitamin A, not beta carotene. Beta carotene is a precursor to vitamin A. You won't get the excess amounts from eating beta carotene, but for preformed vitamin A, which is retinol, it's somewhere around 2,500 units.
So we got the D and the A, and I guess we could
throw vitamin E in there somewhere, from the work that's been done at the Linus Pauling Institute and also at Tufts by Simon Madani, somewhere around 200 to 400 IUs a day. That's in kind of the good zone. And selenium works in this area as well, somewhere around 50 to 70 micrograms a day. So all of these kind of are buddies that work together in immune support. Zinc, of course, and one that you mentioned earlier, somewhere between 15 and 25 milligrams is a good kind of non-therapeutic dose.
Right, and that's all in your Medium April 1st article.
Yes.
You went through everything in that. So what we'll do is we'll link that. I kept you over. I wanted to keep you 60 minutes. I apologize for that. So before we check out, let everybody know how they can get in touch with you. I think it's drjeffreybland.com.
Just Jeffrey Bland, JEFFREYBLAND.com. You can find me there. And we have linked to all of our meetings, all these videos from experts that have spoken at our meetings that are free of charge, that can be viewed on all aspects of the immune system. So if someone wants to dig deep and go into topics in much more detail, they can have access to that information. And
you've got some online stuff with the Personalized Lifestyle Medicine group, correct?
Yeah, if they go to jeffreybland.com, it'll give them a link over to our Personalized Lifestyle Medicine Institute repository of 30 years of work. So they can find probably more than they'd ever want over there, but they can be directed over to that site.
Well, I have to tell you, thank you so much for taking time out to chat with me. I can't tell you what an honor it's been. For the 21 years I've been practicing, that first time that I saw you, I said, man, I got to get smart like this guy. And I'm looking, I'm trying. And that's what everybody says. And, more so than that, having had a couple opportunities to sit with you at dinner and talk to you, forget all the accolades, a man of integrity. And one other thing, you don't stop. I mean, my hat's off to you. You don't stop. So whenever I get tired, I think of you and some others. I'm coming. And you've been inspiration for so many. Please keep up the good work. Thank you. I hope we can do this again.
Well, I can tell you, you're an inspiration. You're the reason I'm still doing what I'm doing. My wife sometimes asks you, hey, Jeff, you're 74. Isn't it time to kind of back off a little bit? It's due to people like you that keep me inspired and keep me recognizing that we all have still work to do. And every day is a new opportunity for recreation. So thanks for all that you do. It's very, very important.
Thank you very, very much. As Jim Rome said, take care of your body. It's the only place you have to live.
Be well.
Well, thanks for your time.